where were we? More mental health, but we stopped off on, an idea of getting your private healthcare system involved and how that could, what that would look like, right? It's not easy. Been there, done that many times. And you just have to try, right? And keep trying. And eventually, you'll be successful. If you don't try, you will not be successful. Okay. Women's mental health. So nothing new here. I mean, I'm sure you're all aware of it. The reason we're bringing it up is because today we're talking about women's health, right? So why wouldn't we? But mental health is an issue because of the stigma. It has existed forever. Medicine has included it as part of health forever. There have been psychiatrists forever. There's, more recently in time is psychologists who do not prescribe, although that's changing now. But that's essentially part of the healthcare system, okay? The stigma is it's not real, right? It's all in your head, which is ironic because it is. But it's something that you can get over, right? Oh, just snap out of it. This whole depression thing, anxiety thing, just deal with it, right? So I think more recently it's been shown that it's not a mental only state, it's a physiological state. Physiologically, we are made differently. And in certain physiological states make you susceptible to depression, to anxiety. So it's not something you do, it's not something you eat, it's who you are. And so that's probably the biggest problem with mental health, is teasing out or making the distinction between a health condition and what's culturally acceptable. Okay? And that's the problem, is that, as we've evolved, it used to be that you wouldn't even admit you had, an illness, right? Of any form, right? Now you're pretty comfortable saying I have type 2 diabetes. People are like, oh, me too, So it's not really a big deal. But very few people are going to say I have clinical depression or I have generalized anxiety. No one's going to admit that. It's definitely changing in Canada dramatically, maybe in the last few years. Like literally that soon. There's also a term called neurodivergence. So neurodivergence means, people who have suffer from, autism, right? Or, that form of the spectrum. And so we put it all under neurodivergence. And that's acceptable now, right? To express that, to say that, you suffer from that. So it is changing, but I would say it's even more of a problem if you're a woman, unfortunately, because there are many stigmas around mental health in women, and it's going to take longer to go away, right? So that's the reason we're talking about it today, is all of this represents huge problems for data. Because remember, I'm here as a data scientist, right? I'm not a clinician. I'm not here to preach about mental health. But what I am telling you is it's a huge problem for you as engineers, okay? Just the gender issue is a huge problem. I'm just going to guess, and I'm not going to ask, but I'm going to guess that many here in the room would have had a hard time making the difference between sex and gender. Okay? So understanding the concept of gender identity versus sex at birth is right away already a challenge. Because how does gender affect the outcome you are modeling? You need to understand that because you're the engineer. And if you don't understand it yourself, how are you going to model it? So you need to work with your, who's giving you the data to better understand the impact of gender on whatever the outcome you're working with. There may be zero impact of gender. Maybe gender is not the issue. Maybe it's just sex. Maybe it's just physiological differences between males and females. Maybe that's the only thing you're modeling. Great. But if gender identity is going to change the behavior pattern that you are modeling in state transition for reinforcement learning, then you need to know about it. Okay? All right. We kind of hit this one already, but you know, these are just the reasons that you have problems with your data collection. And I'll tell you another problem that happens is changes are happening in India, correct? They are. I mean, seriously. I mean, for me to even be talking about what I've been talking about like 10, 15 years ago would have been like, you know, I would have been sent home, right? So it definitely is changing. And I'm saying same thing in Canada, right, by the way. Like, you know, if I had been given a conversation, you know, talk like this, you know, 10, 15 years ago, people are like, wow, you know, what, gender? That doesn't exist, you know, right? So, you know, you have to keep it in mind, because if you're modeling things over, I'm going to come back to it again. If you're modeling things that have retrospective data over time, you've got a huge problem, because the way it was collected changes over time. How we appreciate a gender has changed over time, right? There's even gender and sexual preference. So you have to keep that in mind as well, because that does change behavior, right? And it is part of the person you are modeling. And so asking about sexual preference in a form I don't know, but I suspect it's probably more difficult to ask for it here in India than it would be in Canada, right? So in terms of, you know, now it's standard in our forms. Like when you fill it out, you'll have, you know, if it's a complete form, you're going to have sex at birth, you're going to have gender identity, and you're going to have sexual preference, because they're all different. And so you're going to say, well, who cares? Like, you know, why do we care what your sexual preference is? That's something that you do behind, you know, at your home. And that's true. It's private. The only thing is, clearly, it makes you different. That combination makes you different. What your sex is at birth, what your gender is, and what your sexual preference is going to make you different than somebody else who has a different combination. So when I want to be able to know what drug to prescribe you, that may have an impact. I'm not saying necessarily, but it may, correct? And so I need to model that. So if you don't know that information, what does it end up becoming in your model? If you don't know those answers, and they do impact your outcome, what does that become in your data? Who here has done statistics? Come on, man, seriously. No one in the room has done statistics. Please. No? Oh my God, wow. You guys are so quiet, it's like crazy. So in statistics, when you're doing regression, who here has done regression? That's part of statistics, by the way, regression. So as an engineer, if you've modeled regression, you've done statistics. So the only thing is, if you're doing statistics, you're probably not doing it at the same level as machine learning, where you have so many parameters that you're hands off. In classical statistics, you're the one who's modeling. And so then you know the variables you put in your model. So you have to understand, in a statistical model, you're trying to predict something using regression, correct? Your independent variables are predicting your dependent variables. So what is the most basic form of a model you can have? What's the most basic form of any predictive model? Give me an example. Ooh, what's that? So wow, that's not bad. That's pretty good. But that's actually already a little too advanced, because you now have a parameter for the slope, correct? I want simpler than that. Even simpler than that. Okay. So, but what is it? What's that parameter you're modeling? Doesn't have to be linear. I didn't say linear. Did I say linear? I didn't say linear. I said model. Okay. I want to predict the next person that comes in the room. Dr. Shakar. He's not here. I want to know his body weight when he walks in the door. How am I going to do that? I want to predict his body weight when he walks in that door. How am I going to do that? You engineers over there. How do I do that? What's the easiest way for me to predict Dr. Shakar's body weight and why? Compares height. Okay, that sounds kind of complex though, doesn't it? I have to first know your height, and I have to know your weight, and I have to model that. Yeah. Too complicated. What's that? So actually measure his weight, so that's a measure. So I'm not predicting now, I'm actually measuring. So I want to predict it though. Come on, man, come on. Come on, you engineers. Too complicated. Too complicated. So like spatial area, like surface to volume or something. Way too complicated. You guys are thinking way too hard. Way too complicated. Screening how? So you guys are thinking way too hard. You can guess. Okay. Now we're getting there. That's easy. That's easy. We could just guess. You're right. Absolutely, we could guess. And the chances of nailing it's probably not very good. Right? Although it's interesting, that would be a sort of Bayesian. Oh, okay, we're one. So that's Bayesian. The reason for that is because you know your body weight, and you know your son's body weight, and your mom's body weight. So then when you guess Dr. Scar's body weight, you're going to put it in that range of Bayesian. But I don't want to do that. I want to predict. You still haven't answered it, and the reason you haven't answered it is because A, you probably haven't taken my stats course, but B, you're thinking too hard. So what if I ask all of you in this room to step on the scale, and I took the average weight of this class? Wouldn't that be an estimate of the next person to come into the classroom, their body weight? I would actually be, the mean, if you have a normal distribution, is low and median. I warned you guys at the start of this. So, the low is the most frequent number in the distribution, correct? So why wouldn't I pick that number for Dr. Carter? So what did I need to do that? All I needed was the mean. That is an example of the most simplistic model you can have. Okay? Now you guys are saying height, and you're saying surface area or volume. So what's that? That's a more complex model. Because now you're modeling other independent variables to make a better prediction. The other one that's missing clearly is sex. Because on average, men are heavier than women. And that's a fact. That's not, there's no offense here to women. In general, they are smaller. You see, I didn't use gender, because that would be wrong. Because that's an assigned identity. Sex by birth, at birth, is a fact that women are lighter. But you do have smaller men that are lighter than larger women. So you have an overlap in the distribution. So it's not perfect. And that's the reason you would need sex at birth. You would need the average weight of a class. That could be, the predictor. It could be height. It could be ethnicity, so ethnic background. it could be BMI. It could be, you see how the model becomes more and more complex? And now we're better at predicting. That is what we do. That's what data science is all about. But you guys are thinking machine learning, and so now we're working with potentially thousands of parameters. And that's the departure from classical statistics. If I put 1,000 parameters in my model in classical statistics, what do I get? You get a saturated model. It's a model that's of no use to you. Okay? You have to use another approach, which is machine learning, to deal with so many parameters, and you will never understand the relationship between all those parameters. That is the black box. Okay? That's the black box syndrome. So in women, the problem is you have so many parameters, but you're going to be missing a bunch of values. Over time, things will be changed over time, the way we collect it over time. That causes problems. So if that is introduced into your model, what do you end up with? Uncertainty. The model has uncertainty, which results in error. Okay? Or noise. So when you have incomplete data, it results in noise. It results in error in your model. That's what you get. And that's what you should be worried about when you're modeling. Okay? Does that make sense? So I'm showing you reasons for why you're going to get noise or error in your model. It's because the data you collected is not the way you thought it was. Okay? Did we do this? Oh no, we did right. Did we not cover this? No, we did right. Oh yeah, okay, sorry. Just losing my mind. Okay, so breast cancer detection. So what we're doing is AI, right? We've already talked about a lot about this and how to introduce AI. So the most obvious one, of course, is getting cervical cancer from breast cancer. How to do that? That's what we're talking about here. So here's an example of radiology. So I'm very fortunate. I have one of my students in my lab is actually a radiologist from India, and he's going to talk to you. He's in Canada, but he's come to Canada because he's interested in AI as a radiologist, and he would like to do research in Canada as a radiologist, and be a radiologist. I believe he might be, pass his license in Canada. But he's going to talk to you about his experience working as a radiologist in India and all of the software he uses. But I think that's tomorrow or Thursday. I can't remember. Tomorrow. So what do? We're looking for this. Okay? Lesions, essentially. Texas lesions in your brain. Can we do that? How do we do that? We use a blood or membrane. Ionized energy, right? And when you observe it, you say, whoa, that doesn't look good. That doesn't look normal. That's a lesion. And then, of course, you're going to biopsy because that's going to be proof positive that you have breast cancer. Okay? But imaging is going to give you that first screening. And so that's what we do in radiology is provide, or what you will do as engineers, is you will work at the best way of processing the signal that comes from I'm very careful to state that we're not processing necessarily. Why is that? You engineers are very far with that. Why do I not only say image? What is an image? You're forgiven. But for the rest of you, you're not. So what is an image? What's an image? Question. Pixel. Wonderful. What's a pixel? It's a yeah, okay, intensity level. Sorry, I'm starting to get used to the accents and the dialects stuff. So it's an intensity level. Excellent, that's correct. But what is an intensity level? It's a sure, but numerically it is it's a value, it's a number, it's a number. So what are inches? They are numbers. The numbers. Right? It's a year. Exactly. It's location, okay, so we're going to be in it. And it's values of intent. That's all images are. And that's why it's math. It's math. So why does the computer need to do this? It's better than the computer. Does the algorithm actually look at it? I don't know. Sure. But is the algorithm looking at the image? Sure. The numbers, vectors, matrices, tensors. That's all it is. So who needs this? We do. So remember, there is a loss of signal when you process it. So there's a lot of research that cuts out the image. So trajectory analysis, it's a little different because it's a sensory plate. That's just, right? You actually do it. But how else is it? So what is actually receiving? Yes, no. That's converted, correct? So is it an actual image? No. So the only reason it's converted to an image is for us. But there's a lot of signaling when you use it. So there's a lot of research that's looking, and it's saying for MRI the whole thing, is they're looking to process the raw image that comes out of that scanner, and not the image. Just think of it. It's being converted to an image, and then you're applying your math onto that image. Why not apply your math directly over there also? Okay? That was just an aside, but it's something to keep in mind. So here's your cervical cancer screening. So I suspect, that's just not common, here to have these. But these are portable. Right? And so that's kind of the future-ish, right? I mean, don't think this is, not every family in Canada is one of these. No, it's not common yet either. But this is where we're heading, okay? And so this is just an example of what you guys are going to contribute to as engineers, is building these. This would be a medical device, okay? In terms of, I'm going to guess probably this one is a class 3 medical device, okay? And these are used, they are used, but it's not a common statement, right? Not yet. Okay, maternal health monitoring. So, remember that's going to be all supported, as I said, the support you have. So that you could contribute to this, right, in platforms and in phones, AI agents, right? You could definitely contribute to this type of monitoring. We've already touched on this, so I can zip through it. So mental health chatbots for women, of course. We've talked about this. Great, why not? Let's, go do it. Now you would include an AI agent, right? An AI agent is connected to an LLM, right? Gynecology for sure. So we have a project that's underway in our lab for what's called an adnexal mass. So it's a mass that's in the cervical area in women, abdominal, cervical. And the tricky bit, of course, is you need an expert to take the ultrasound, and then you need an expert to review the ultrasound, et cetera, et cetera. And so we're developing an algorithm to identify the mass, segment it, and all that fun stuff, just automated. It already exists. There's many other algorithms that do it, but what we're trying to do is fully automate it from what's called the cine loop in ultrasound, which is basically video clip, Okay, so when they take the ultrasound, they record a little video clip. And instead of asking the expert then to segment manually the area of the mass that they suspect is a mass and then make the diagnosis, we take it straight from the video clip. So we cut out the need of an expert to segment the mass. So there's an example of where we're working on that. Of course, the early detection is key. So this is where it can be very impactful, is in LMIC, low middle income countries, where the ability for whatever reason, and it's a problem because early detection leads to better problems. But it really is not a good thing. Very lung cancer and cancer is killer. And so we just detect it early on. It's just so that one is that's but in many other ones, early detection is better. But if you leave it for too long, it will metastasize. Breast cancer often ends up metastasizing to the brain. So you want to capture it early before it has the possibility of metastasize. And that's your job, right? As engineers, is to put together solutions that are going to provide early detection. Access, so barriers to access is another one, which I have a particular interest in, as you know, for global health. But I just really think it's low-hanging fruit for AI. Because you're so comfortable using it at home. You know, your phone, right? Accessing the internet, you're using your phone. Why would it not be a good vehicle for early access for some, not all medicine, right? You're not going to detect lung cancer and treat lung cancer with your phone. It's not going to happen. And that's okay. We can't fix everything. But there are many, many, many health concerns that can be addressed through simple technology. And what a shame that we're not taking advantage of it. Especially for those of you, and we're all at fault of doing this, and that is, telling our children, oh, you're on the phone too long, oh, you use the phone too much, get out there, and okay. Realistically, our children are not going to listen to us, right? That's true because I didn't listen to my parents. So, why would I expect my kids to listen to me? They're not going to. So, and the generation won't listen to the older generation. It's a fact, right? And there's nothing wrong with that. That's fine. It's just the way it is. But you are going to use your phone. You can't get rid of your phone. You're not going to have your phone confiscated. You are going to use ChatGPT. You are going to use large language models. So what's important is to use them right. And that's where our generation has a role. And that is to provide you with the education required to benefit from those tools. So by burying your head in the sand and pretending that you shouldn't use it, and our children should not use it because it's such a bad thing, it's going to rot their brains, as everybody says, all you're doing is delaying the inevitable. And you're actually pushing the use of the phone to somewhere where it's not governed, where there are no guidelines, recommendations. You're pushing your children to use it without your education and your insight into how they should use it. That's the problem. And so that's exactly what's going on with access to care. By not using it, we're putting so many people at a disadvantage. If we were all privileged, we were all rich and privileged, then it would be a non-issue. But we're not all rich and privileged. So why not leverage the technology as best we can to profit everyone, right? And that's bottom line. That's what this is for. So all of these things are possible. Some of them more or less in terms of cost. So I am mindful of that for you. Because I already know, my first startup company was a medical device where it costs money to use our medical device. So I was very, aware that I was actually developing a medical device for the privileged. There's no doubt about it. I knew that, right? So just, as long as you're aware of it, it's okay. But I know there's a pay barrier. And it's going to be the same thing here. Hypertension, you say, oh, well, you can monitor your hypertension. Great. But you have to have a means to measure your hypertension. To do that, you have to buy a monitor. Okay? So that's going to be a problem. COPD, same thing. You need to be able to test for it. And heart failure, which is once again, there's a medical device involved, right? Diabetes, we just had a fantastic talk about that. So you do need to be aware of that, but there is definitely things you can still do that's cost effective, right? That there's not super amounts of cost, right? So that's the challenge to you, right? Is to find something that works for you here in your community. That's what you need to do. Future directions, we've talked about all this, right? So keep an eye on this. The reason I brought it up, the reason that, Dr. Cigar asked for it was just bring awareness to how he does it. Right? Women's health and men's health is not fit. I used to go through this a lot. I worked at the hospital for children as a scientist for 13 years. And so that was a problem for children, and I suspect the same problem with you. That children are small adults. They're not. Okay? The physiology of a child is different than that of an adult. Okay? So you can't treat illness in children as you do in adults. It doesn't work. It rarely does. Okay? So it's the same idea. You can't treat women from clinical studies that were on men. Doesn't make sense. Okay? And so that's what we're just trying to emphasize today. All right? There you go. So that's it for sure. Yeah. That's it for the women's health. And then I think we're going to segue into my first company. Yeah. Let me have a question.